Hello, I'm Terry High, founder and CEO of the Chelsea Project. We're a nonprofit 501c3 mental health advocacy organization in Taylor, Michigan. I formed this organization for my 27-year-old daughter, Chelsea Ray. She has a fiance, Eric Spangler, and three children ages 3, 4, and 8, and she's a graduate from Dorsey's Certified Medical Assistant Program. She's suffered from severe psychosis since August 20th of 2022. She's currently on her ninth hospitalization and is currently at Grove City Hospital. She's spent over a year away from her children and her fiance between hospitalizations, living with me, and group homes. We've come across every treatment barrier you could possibly come across, starting from a lack of long-term treatment facilities. Most short-term treatment facilities, their policy is to get the patients in and within 3 to 5 days, and some are as short as 23 hours. The insurance companies start pushing for discharge after 45 days and won't let you stay any longer than 90. Also had a problem with insurance not being accepted, where, for instance, U of M does not accept Wayne County Medicaid, and other issues where Henry Ford wouldn't accept out-of-network transfers. There are certain treatments that aren't covered by Medicaid as well. We've looked into electroconvulsive therapy and transcranial magnetic stimulation. The TMS, it is covered for major depressive disorder, but it's not covered for schizophrenia. The electroconvulsive therapy, it is covered by Medicaid. There were also issues with filing complaints against different hospitals and filing with their recipient rights. The way the legislature is currently written, the rules and regulations are written so loosely that it's left up to each individual hospital to interpret. Hospitals investigate themselves, and there's no state or federal oversight committee. We've also had 2 incidents with hospitals having no gender-specific floors. They were all co-ed, or not placing them on a co-ed floor until something happened. It leaves patients in an unsafe environment. With my daughter being catatonic, it led to the sexual assault by another patient. We currently have 2 lawsuits going with 2 different hospitals right now. And after discharge, there's inadequate services. There's no patient education. We've gotten no real direction on how to deal with her psychosis and how to deal with her episodes. It's been a learn as you go basis. Basically, when she was discharged, they said, she's schizoaffective. Here you go. Our organization is going to try and help fill that gap that the community needs, along with providing basic needs such as food, clothing, furniture, household items, and other things like that. With the current system, it leaves patients in an endless loop. Anyone could be in the same situation I am, or even Chelsea is. According to a news article put out by WXYZ on May 13th, 2019, titled, "He left a Detroit psych hospital on Friday and admitted to murder on Sunday." Joe Sadilak was never the same after a closed head injury in 2016. That could happen to any of us going down the street. He admitted to stabbing Clinton Decker to death and was deemed mentally unfit to stand trial. The next news article that I'm going to refer to, I used this to explain to my daughter why I had to get guardianship of her. According to the U.S. News on October 6th of 2022, mental health check turns deadly after Detroit police fire 38 rounds at a man with a knife. 22-year-old Porter Burks was shot 38 times during a mental health crisis. Another question that my daughter asked me all the time is why she couldn't go back home to her children. So I brought up another news article for her. U.S. News, January 6th, 2023. Sheriff, Michigan mom, kids die after mental health crisis. 35-year-old Monica Candy thought somebody was trying to kill her and her children, so she gathered them up and left the home. Her and her two sons, ages 3 and 9, died of hypothermia. Her 10-year-old daughter survived. The economic burden of this mental health crisis falls on the taxpayers. Chelsea's no longer able to work, which means she doesn't pay taxes. She receives Social Security. Her hospital bills from August 2022 to October of 2023 added up to $142,148.90. Currently in the state of Michigan, there's 2,197 beds for mental health. Most of the time, these facilities are completely full, and you spend 3 or 4 days in the emergency room waiting for a bed to open up. So that estimates $454,165,703.55 a year that taxpayers are responsible to cover. On July 31st, 2023, Governor Whitmer signed in the Make It in Michigan budget to improve access to health care and affordable care that meets their needs. $25 million was allocated to local health departments to provide essential services. Yet only one state hospital was being built, where the Hawthorne facility currently is. They allocated $325 million towards this for the next fiscal budget. We are in dire need of services and facilities, but they still put away $200 million a year in a rainy day fund. The proposed balance of this fund by the end of fiscal year 2024, is $2 billion. On May 31st, 2022, the White House released Reducing the Economic Burden of Unmet Mental Health Needs. They stated that mental health disorders result in a large economic cost to those affected, their families, and society as a whole. People with psychiatric disabilities are the largest increase in Social Security in years. 29% of the beneficiaries in 2022 were allocated to mental health disorders. Additional costs to society include homelessness and incarceration. There's a way to reduce the economic burden. We have to treat the mental health, rehabilitate these patients, make them productive members of society again. We need adequate capacity and adequate workforce, and we need to rebuild the infrastructure for the mental health care system. We also need to increase the insurance coverage and close the gaps. We also must destigmatize mental illness. You can find us on Facebook under groups, The Chelsea Project. To donate to our organization, we accept Venmo at The Chelsea Project. We also accept Cash App, $ The Chelsea Project, and Zelle or PayPal, mi.thechelseaproject@gmail.com. Thank you for listening.